Assalamualaikum everyone. In this video, I am going to talk about on how to take the pediatric history. So the history from the adult and pediatric history are almost the same, but there are some differences in pediatric history. So these differences are birth history, developmental history, the feeding history, and the immunization history. These are the extra points which should be asked from the patient while taking the pediatric history, and these points are not asked from the adult while taking the adult history. So the first thing in the history taking is the biodata. In the biodata, you have to ask about the patient name, their father name, the sex of the patient, whether the patient is male or female, and the age, the residence where he or she live, the date of admission, and which date the patient came to the hospital, and mood of admission, whether the patient came to the emergency or whether the patient came to the OPD. So now the second thing that is to be asked in the history taking is the presenting complaints. In the presenting complaints are those complaints for which the patient came to the hospital. So this should be in chronological order. Chronological order means those symptoms which start first or which develop first should be written first. For example, if the patient has fever from 12 days and vomiting from 10 days and loose motion from 8 days, so the duration should be written in front of each complaint. The third point in the history taking is the history of presenting complaints. Each presenting complaint should be elaborated now. And to elaborate each presenting complaints, there is a mnemonic which is the OSF DERA. So the O for onset of disease, the onset of fever. For example, here is the fever, the presenting complaint is the fever, so the onset of fever. Whether the fever start sudden or gradual. The second is the severity. The second is the severity, whether the fever is mild, moderate, or severe. And the third point in the presenting complaint is the frequency. And the D for the duration, and the E for the exacerbating factor, which factor actually exacerbate the fever or any other presenting complaint. So R for the relieving factor and A for the associated factor. For example, the fever may be associated with vomiting, with weight loss, it may be associated with cough, or it may be associated with abdominal pain, something. The fourth point in the history taking is the systemic review. So in the systemic review, you should to review each system of the body. The first system that is to be reviewed the central nervous system. In the central nervous system, ask about the loss of consciousness, the mental status of the patient, whether the patient feeling any weakness or paralysis of limb, the visual disturbances, weakness or any paralysis of limb, visual disturbances, deafness, speech disturbances, and fits. The second system that is to be reviewed is the cardiovascular system. Ask about the patient breathlessness, palpitation, chest pain, or edema fit. You should to check the edema fit. And the third system that is to be reviewed is the respiratory system. In the respiratory system, you should to know about the patient breathlessness, wheezing, cough, sputum, hemoptysis, nasal discharge, or obstruction. In the fifth system that is to be reviewed is the gastrointestinal system. Sign and symptom for which the physician should be asked is the nausea, vomiting, abdominal pain, jaundice, difficulty in swallowing, diarrhea or constipation, and the hematemesis and melena. So the last symptom that is to be reviewed is the urinary system. In the urinary system, ask about the frequency of maturation, the oliguria, polyuria, nocturia, lumbar pain, and hematuria. So the fourth thing that is to the fifth thing that is to be asked in the pediatric history is the birth history. The birth history is further divided into antenatal, natal, and postnatal history. In antenatal, we are actually inquiring about the mother health condition during the pregnancy. So The mother have any chronic disorder during pregnancy. For example, chronic disorder may be diabetes mellitus, may be hypertension, it may be fits, and any illness, TB or rubella. Then ask about the drug history, the substance she is taking. For example, she may smoking and the maternal vaccination, whether the mother is vaccinated or not. And the second point in the birth history is the natural history. In the natural history, we are actually inquiring about the pregnancy and delivery, the duration of gestation, the mode of delivery, whether the delivery is spontaneous, assisted, or C-section, and place of delivery, whether the delivery was done at hospital or at home, and the delivery conducted by the ER doctor, and a complication during delivery. In the third part of the birth history, the postnatal history. This is the history which is asked after the delivery of the baby. So the baby is cried first or not. The cry was immediate or delayed. And time of onset of respiration, whether the respiration the child started after delivery or after few minutes. So the birth weight, the birth injury, feeding difficulties, cyanosis or jaundice at birth. And the sixth point that is to be asked in the pediatric history, developmental history. The age at which the milestone were achieved. The milestone are the smiling, holding his neck, crawling, walking, running, talking. These are the milestone which are developed at specific age of the baby. In the behavior interaction with other children. What is the behavior interaction with other children? The other is feeding difficulty, which is also a point which is different from that of the history from the adult. So it is particularly significant in those children whose age is less than 2 years of age. And the time between the birth and the first feed. In the feeding history, the question that is to be asked are the time between the birth and first feed, types of feeding, breastfeed or formula feeding, and frequency of feeding, quantity and dilution of bottle feeding. Weaning. Weaning is actually the introduction of another food other than breast milk. So this is the weaning time. This is the weaning, and you should to ask about the weaning time and any change in food intake during illness. During illness, whether the food was changed or not. So the another thing that is different from that of the adult history is the immunization history. In the immunization, ask about whether the child is completely immunized, partially immunized, not immunized at all, or whether he or she received the boosters. So the family history, ask about the history of parents, about the any illness, chronic illness or acute illness, sibling or relative suffering from any disease or inherited disorders. So the personal history, and the personal history ask about the child particular habits, their sleep, their appetite, their weight loss and addiction. So, in the last thing in the history taking is the socioeconomic history. In the socioeconomic history, ask about the detail of house he or she is residing, and the financial status and earning source, in the hygiene in the house and the locality where she or he is residing. So, this was all about on pediatric history. For more videos, subscribe, like, and share. So, thanks for watching the video.